60 action phase 4 treatment of the lower extremity. So we started with the pulsation, 1 second interval, once again now from the left subclavicular fossa area, 10 to 15 pulsations. For the lower extremity it would be also good to do the abdominal with the same 2-3 pulsations on one spot, and you would do clockwise the stomach. This is still activation of the lymphatic system, and the lymphatic activation on the lower extremity, you start from the groin area on the hip, 2-3 pulsations on one spot. I usually do with the biggest cup 3 spots on the joint area, and then I start going downwards the foot. 2-3 pulsations. If you want to be already a little bit active, you can also with the pulsation also do a little bit of lifting and twisting. The medial side, once again, is extremely important with the foot. After the knee, usually you have to change the cup to a bigger, smaller one to really reach the desired area. And you continue all the way to the bottom of the foot, and you come up. And for example, now if it would be a knee problem, you could also do a dual function by changing the hose to a dual hose. And now you have 2 hoses in the end of the hose, and you attach 2 cups, and you do dual hose treatment. If you want to work with a continuous mode, you take the pulsation off and you do a continuous suction, and then you start lifting, twisting and pumping the tissue. Once again, don't create any pain underneath. Cup is about 5 to 15 seconds in one spot. You can also start pulling, pushing the tissue. With a good force. And then when you want to do the gliding, you can also glide with a good, if there is too much pressure, you just reduce the pressure and you do gliding towards the lymphatic nodes area. And once again you end up the treatment with the pulsation mode. And now with the dual cup function you can even do simultaneously the groin area and then also the subclavicular fossa. 10 to 15 pulsations to finish up the treatment. And then we will do the taping. And you would need 2 handles on the hip, 2 for the knee, and then 1 or 2 for the activation of the lymphatics in subclavicular fossa. And it would be the activation handle for the subclavicular fossa area. For the hip area activation. No stretching to the tape. And then the knee area. The middle one into the knee joint. And now once again, if you have to make a turn to avoid wrinkles, then you can just do a stretching 10 to 15%, but otherwise no stretching into the tape. The tape is not stretching underneath the handle, so you maybe don't want to put too many handles in a row. You can cut them into one piece or two pieces or three pieces so that it doesn't stop the or reject the motion of the joint, restrict the muscle function or the joint function. So you would wait for 20 minutes before the activation, but now we started already. So 20 times from the subclavicular fossa area activation, up and down. In the hip area as well, 20 times up and down and side, lifting, twisting. And then in the knee area, different directions, going around 5 to 10 minutes, and especially then downwards as well to push the lymphatics into the subclavicular or to the lymphatic knots. And then you end up the treatment by finalizing the activation, the final lymphatic knot place activation 20 times and 20 times. And this would be the lower extremity treatment.